Hello dear students, today we will see some of the spotters related to lower limb. So we will see the first question. A. Identify the pointed structure mentioning the region. B. What is its function and how will you test its integrity? So you are seeing the knee joint and you can see the femur here. These are the femoral condyles. This is the lateral condyle and this is the medial condyle. This is the tibia. Here you can see the fibula. And this is the anterior aspect in a flexed knee. So this region is the knee joint and the structure you are seeing is the anterior cruciate ligament. So what are these cruciate ligaments? The cruciate ligaments are seen inside the knee joint. They are the intra-articular structures. Now the name cruciate means cross-like. That means the cruciate ligaments are arranged in the form of letter X. There are two cruciate ligaments. They are anterior cruciate ligament and posterior cruciate ligament. So the anterior and posterior are decided based on their attachment to the tibia. So the anterior cruciate ligament will be attached to the anterior part of the intercondylar area of tibia, whereas posterior cruciate ligament will be attached to the posterior part of intercondylar area of the tibia. Now we'll see what is the femoral attachment of the anterior cruciate ligament. So we have seen that the anterior cruciate ligament has got the tibial attachment to the anterior part of intercondylar area of tibia. So the femoral end is attached to the posterior part of the medial surface of lateral condyle. You can see the lateral condyle here, and to the posterior part of the medial surface of the lateral condyle, the anterior cruciate ligament is attached. Now we'll see what is the function of the anterior cruciate ligament. It prevents the posterior dislocation of femur on the tibia and also anterior dislocation of tibia on the femur. Now its integrity is tested by a test known as anterior drawer test. The anterior drawer test is done in such a way that the patient is asked to lie in the supine position and both the knee joint and hip joints are flexed. Now the ankle joint is also immobilized by firmly holding it. Now what you have to do is you should pull the tibia forward. If there is excessive forward movement of tibia, that means the anterior cruciate ligament is torn and that indicates anterior drawer test positive. The posterior cruciate ligament has got the tibial attachment on the posterior part of intercondylar area and the femoral attachment is to the anterior part of lateral surface of the medial condyle on the femur. So what is the function of the posterior cruciate ligament? It prevents the anterior dislocation of femur on tibia or the posterior dislocation of tibia on femur. Now the posterior cruciate ligament is tested by the posterior drawer test. You should ask the patient to lie in the supine position with both hip and knee joint flexed, and also the ankle joint should be firmly held to immobilize it. Now what you have to do is you should push the tibia on the femur posteriorly. So if there is excessive posterior movement of the tibia, that indicates the posterior drawer test is positive. That means the posterior cruciate ligament is torn. Now we'll see the second question. The second question is identify the pointed structure. B, that is what is it a continuation of? C, write its surface marking. So the pointed structure is dorsalis pedis artery, and it is a continuation of the anterior tibial artery. The surface marking of dorsalis pedis artery is, take 2 points. The first point is between the two malleoli, that is the midpoint of the two malleoli, and the second point is the proximal end of the first intermetatarsal space. Connect these 2 points with a line that indicates the surface marking of dorsalis pedis artery. You can feel the dorsalis pedis pulse by palpating the artery just lateral to the extensor hallucis longus tendon. If the pulse is absent or diminished, that indicates that there is arterial insufficiency of the lower limb. That means any of the vessels of the lower limb, like the femoral artery, popliteal artery, and the anterior tibial artery, those are the proximal arteries of the dorsalis pedis artery. So if all these vessels or any of these vessels are blocked due to a thrombosis or embolism or atherosclerosis, that can lead to arterial insufficiency, that would lead to diminished or absent dorsalis pedis pulse. Now further absence can lead to gangrene of the foot. Now we'll see the third question. A, identify the pointed structure. B, mention the structures forming the floor of the given region. So let's see the answers. Now first you should identify this region. So this region is popliteal fossa. So how will you identify this as popliteal fossa? You have the supralateral boundary that is found by the long head of biceps femoris here. You have the supramedial boundary by the semitendinosus. This is semimembranosus. The infralateral boundary by the lateral head of gastrocnemius. Inframedial boundary by the medial head of gastrocnemius. That's how you identify the region. So the structure that is passing close to the long head of biceps, that is, it is passing medial to the long head of biceps femoris, and that is the common peroneal nerve. So the pointed structure is the common peroneal nerve. It is a smaller terminal division of the sciatic nerve, and division occurs at the upper angle of the popliteal fossa. The sciatic nerve divides into the tibial nerve and the common peroneal nerve. The common peroneal nerve passes medial to biceps tendon, follows the tendon up to the back of head of fibula. Now the structures forming the floor of the given region are the popliteal surface of femur in the upper part. In the intermediate part you have the capsule of knee joint or oblique popliteal ligament. And in the lower part you have the fascia covering the popliteus muscle, and this fascia is derived from the insertion of semimembranosus. To know more about the popliteal fossa, please watch the video that I have taken before. Now the fourth question is, identify the pointed structure with green arrow, write its root value and mention any 4 branches. Now let's identify the region. This is a specimen showing the anterior compartment of the thigh. You can identify the inguinal ligament. This is the sartorius muscle, and you can see one nerve, one artery and vein here. So this is the femoral triangle. Now the structures arranged in the femoral triangle are vein, artery and nerve from medial to lateral, that is VAN. VAN structures from medial to lateral, that is vein, artery and nerve. So this nerve is nothing but the femoral nerve. Now what is its root value? Root value is dorsal divisions of the ventral rami of L2, L3, L4 spinal nerves. The femoral nerve divides into anterior and posterior divisions just below the inguinal ligament. So it has got a short trunk. So now we will see the branches arising from the trunk, anterior division and posterior division. From the trunk you have branches to the iliacus and pectineus muscles. Then also vascular branches that ramify on the femoral artery. From the anterior division there is one muscular branch and 2 cutaneous branches. The muscular branches to the sartorius muscle and the cutaneous branches are intermediate and medial cutaneous nerve of thigh. From the posterior division you have one cutaneous branch and 4 muscular branches. The cutaneous branch is saphenous nerve and the muscular branches are to the quadriceps femoris muscle. You know, the quadriceps femoris has got 4 parts: the vastus medialis, vastus lateralis, vastus intermedius and rectus femoris. To all these 4 muscles the posterior division supplies. Now we'll see the last question for the day. Identify the pointed structure with blue arrow. Name the structures piercing it. The pointed structure is the flexor retinaculum of foot, and the structures piercing it are medial calcaneal nerve and artery. Another important question that is usually asked along with this structure is the structures that pass beneath the flexor retinaculum. So the structures that pass beneath the flexor retinaculum of foot are remembered by a mnemonic: Tom, Dick and Naughty Harry. So the T stands for the tibialis posterior tendon, D stands for the flexor digitorum longus tendon, A stands for the posterior tibial artery, N for the tibial nerve, and H stands for the flexor hallucis longus tendon. So we'll identify the structures again. The 1 denotes the tibialis posterior tendon, the 2 denotes the tendon of flexor digitorum longus, 3 shows the posterior tibial artery, and along with that you have also the accompanying vena comitans. 4 is the tibial nerve and 5 is the tendon of flexor hallucis longus. I hope these topics are clear for you. We'll come up with further questions in the coming days. Thank you.